A harmless thing like a pollen. So the pollen may not affect you, but it will affect my body because my body is predisposed to overreact to the presence of pollen in my respiratory system. Right? So it is an exaggerated response. There can be variety of symptoms, and every patient presents in a different way. So one is the nasobronchial allergy. The second thing is the skin allergy. You may have itching, you may have rashes. There are two seasons which are very important, and I call them, a holy season and a Dashera season. Various tools to find out how good or bad your asthma is. One of them is called as a peak flow meter. If you start doing intervention 5 days ago, you will not have this symptom. And the lesser the symptoms are, the better it is. Inhalers are non-addictive and steroids are safe.
Hello everyone. So viewers and listeners, today I'll be taking you to the journey of allergy along with an eminent respiratory medicine specialist, Dr. Ashish Jain from Max Hospital, Delhi, and I'm your host, Dr. Prashant Nag. Welcome, Dr. Ashish, to this podcast.
Thank you very much for calling me. I'm so honored to be here in this eminent place, and where we can both discuss and share our knowledge and help the patients.
Allergy is a common parlance word. It's not just a medical word. And we understand that there are respiratory allergies, food allergies, then there are drug allergies. That intolerance is a separate topic, food intolerance specifically. So as a medico, what I can say is it is easier to speak, tough to understand, and most difficult to diagnose. So just your views, how do you deal with your patients daily in and out of allergy, and how does allergy itself affect the body?
So let us first try and understand what the allergy is. So allergy is a exaggerated response by certain individual, or rather bodies of certain individual. Harmless. Why I say that we are not talking about toxic gases, right? We are talking about a harmless thing like a pollen. So the pollen may not affect you, but it will affect my body because my body is predisposed to overreact to the presence of pollen in my respiratory system, right? So it is an exaggerated response. So in all these, and this pollen for me, for you it is just a pollen, and for me it is what has we called as allergen, right? And this allergen, when my body comes in contact with this allergen, when I inhale this allergen, then there are mast cells in the mucosal membranes. They take it, and then it gets attached, and then it releases various hormones, specifically the histamine. And this histamine causes all the reactions and all the display of the symptoms of allergy, be it in the skin, be it in the nasobronchial tree, or be it in the gut or elsewhere in the body.
Yeah, so it is primarily a differential exaggerated response of our own immune system to something which are probably not that harmful, but maybe induce a response.
Yeah, that is in the people who are predisposed to this.
So, Dr. Ashish, as you said, that there are people who are predisposed to. So, predisposition is governed by the genetics, that is the inheritance, or is it governed by the lifestyle? What is the most contributing factor when it comes to, say, manifestation of allergy?
So every individual has got a different set, right? In some individual, it is the genetic makeup, it is the inheritance from their parents that is predominant. In some other, it is it is the lifestyle things. Sometimes, if you have had a bad pneumonia or a bad viral, you start displaying the symptoms on a seasonal pattern later on in your life, which were sort of hidden initially. So
So it just uptick the allergy.
yes, it upticks the allergy. That's the right word. So, but yes, genetic predisposition is a predominant thing that we see in our clinical practice, day-to-day clinical practice.
As we understand that temperature, environment has an important role in the allergy. What type of patients you normally see? Is it always that cold which predisposes the allergy, or is it there are many other things when it comes to?
No. Not only cold, but yes, environmental factor, they play a important role. There are patients, those who are genetically predisposed or otherwise harboring the tendency of overreacting to a, you know, harmless thing. They get affected with different kind of seasonal changes. There can be two types of allergies. One is a seasonal allergy and one is the perennial
Yeah,
allergy,
yeah.
right? So we see in this part of North India that I practice, there are two seasons which are very important, and I call them, a holy season and a Dashera season. Like in the holy season, there are a lot of pollens that are coming
Yeah.
in
That
the
is the
air.
spring season, so
That is sort of the spring season. Similarly, there are, the change of humidity, the change of temperature, the change of the other pollutants and other pollens, the grass pollens,
yeah, yeah.
uh, the flowering seasons, all these things,
They
they
introduce those
contribute,
particles in
they
the
introduce
air
these
and
sort of allergens which are harmless and beautiful to see for some people, but for the those who are genetically predisposed, they incite that immune reaction and gets into trouble.
and it's a well-known fact that there are people who are allergic to, say, cats and dogs. How that work? Matlab, is it there something specific out there?
So the pets, they shed off their hairs and they shed off their danders, right? And there are some dogs, some breed of dogs, they shed a lot of danders and
Yeah,
a lot of
yeah, yeah.
hairs, right? And it is, thrown all over the place in them. Some people, they like to cuddle up with
Yeah,
their
so exposure
pets,
become much
so the
stronger.
exposure also becomes much high. So again, if you are predisposed to show a reaction to this, then these danders, they are very small, you can't even see most of the time, and they are in the respirable category.
Yeah.
You inhale them, you can inhale them, and once you inhale them, then they incite these reaction and you get into the problem. And every time you get into the problem, every time you are into contact, you get into this problem. And one more thing which I must add right now is that every subsequent time that you get in touch with them, the response is much more exaggerated as compared to the previous response.
Okay, so is it with every allergy that more the attacks, more severe it gets?
Most of the time, yes, but sometimes if the quantum of allergen is very high, or if the body is has not been exposed with certain amount of allergen in the past, but it is the first time, you don't know, but first time you are getting into this, then the response can be really very nasty, and it can really bother you. For example, there are patients, from North India, they go down south, or let's say they are holidaying in Goa, and for the first time in their life they are having prawns,
Yeah.
right? Then you really get into the trouble.
Just to tell you my personal own experience, I had to get IV line done for after eating prawns in Goa
Exactly.
when
This
I
is what
first time had the prawns.
yes, this is what I'm saying, because you were not exposed to this particular allergen in your body till you grew up so long, but you were genetically predisposed to
Yeah,
show a exaggerated response.
agreed.
So similarly, people who are going from down south to Valley of Flower in the spring season, can really get very high,
Yeah, yeah,
because the environment totally changes,
yeah.
and you were not exposed to this. But yes, in most of the people, those who are living in the same circumstances, same environment, with every season, the response is much worse,
Exaggerated.
exaggerated as
Got it.
compared
Got
to
it.
this. And let me tell you, if I see a patient in my clinic, and if they say, ki, I have got this cough for let's say 10 days, and then I would ask a leading question, do you have this problem every year? And then they would sort of they are not able to comprehend that, and they
Yeah.
would say, no, no, choti moti khasi hoti hai, but zyada kuch
Yeah,
nahi.
yeah,
And
yeah.
then I would ask them that last year how many days you were coughing,
Yeah.
and the previous day. So it takes a little while for them to understand why am
That
I
is the
asking.
cycle with which
That
they
is
are
the
going.
cycle. And then If you go back, then you will find that 5 years ago or 7 or 10 years ago, this guy was not coughing at all. And then, let's say after shifting from Bangalore
Yeah.
to Delhi or from Delhi to Bangalore, the cough started. Initially, it was 2, 3 days. The subsequent 2, 3 years, after 2, 3 years, it became 5, 7 days. And then now, for the first time, when the patient had this 10, 15 days cough, which was, so initially they just ignored it,
Like a seasonal flu and
like just a seasonal allergy, like just a choti moti cheese. And people usually in India, we
home
have got
treatment of
mothers
kada and
and
all.
grandmothers. So I won't say that's bad, but if it crosses beyond a certain limit, I think one must go for a professional opinion and get themselves checked.
Yeah, that temperature, that herb has their roles, but we cannot just rely on them and keep on.
Yes, if it is just a small thing, okay, 1 or 2 days, that's fine. But if the symptoms they start worsening, if they or if you're not getting relief, then you must come and see a doctor.
You were talking about moving from one place to another, exposing to your allergy. I'll take on a diametrically opposite thing, a myth which says that if you are suffering from allergy, change your place, all your allergy will be cured. So,
So I will stick to this myth, but I will sort of rephrase it once
yeah,
for the benefit of the audience. That if you have an allergy and if you change your location, it will not get cured, but the symptoms will be masked,
yeah,
right? You are still the same person, which is who is genetically predisposed to overreact a certain
yeah,
allergen. It's just that you have removed that allergen from your environment,
yeah,
right? But one has to be cautious that if you are allergen to, let's say, pollens, so if you find the March season in Delhi really bad season, and if you decide to go down south in Kerala in during the March, that's fine. You will not have allergic symptom because of this, but you may have because your body is predisposed to have this
yes, yes,
allergy
yes.
or hypersensitivity. You may have allergy to something else. So
Yeah.
you have to live a cautious life. So if you have a bad March here, if you are going down to Goa, make sure that you are very cautious when you are taking prawns.
Yeah, yeah. So what you can, external factor you can change, but your body is predisposed, so predisposition remains there.
I advise all my patients to at least pick up 3 colors of fruits or vegetable that can be eaten raw with every meal, right? So you can have one green, one red, one orange. You can have one banana. You can have one cucumber. You can have one papita. There are
Yeah.
plethora of colors. The God has been so kind to us, and He has given us so many things. So pick up 3 different colors that can be eaten raw and have them, and make sure that if the doctor has not advised you against it, then at least drink 3.5 to 4 liters of water every day. Do a good exercise that will keep you healthy. And obviously, I mean, if you have a hydrated body, if you have minerals and vitamins which are fulfilled, um, are there to take care of body, then definitely the
Overall,
allergy, the hypersensitivity
yeah.
that we are discussing today is also taken care of partly, and your body is in a better shape to handle this.
Yeah, the predisposition might be there, but optimization of symptoms and overall
Exactly.
your
Yeah.
defense mechanism works better.
And need for medication and response to medication is also better.
Taking this lifestyle discussion further, uh, we do understand that smoking is bad for all types of, has all the side effects, whether it's about related to cancer of lungs, related to cancer of bladder, and multiple cancers. There are 20 cancers where it is directly related. Uh, how does it work for the allergy side? Does it exacerbate that also? And how it
Yes,
works?
definitely. Smoking is bad. Smoking is definitely injurious to your health. And what it does is that there are 2 things, 2 aspects to it. One, the hot smoke that you are inhaling. So that dries up the mucosa membrane, right?
Okay.
So now a dried up mucosal membrane is a bad defense,
Yeah.
right, for the external things that you're inhaling, right? And definitely there is tar, there is nicotine, there are various other gases that you're inhaling. So chemical part, one thing, but since we are discussing about the allergy, let me say, not only it is an irritant, it is sort of predisposing the mucosal membrane to be more irritated,
Okay.
right? So the cigarette smoke is also causing a problem in the lungs, and the allergens that it is sort of encouraging to get attached or
Yeah.
to pass the natural defense, that is also making the things worse.
So
So it
both
is
the
affecting,
symptoms
it
also
is,
get worse, and by any means excess.
and then it becomes very difficult for us to distinguish that how much of the symptoms are because of the smoking induced COPD and how much of the symptoms are because
Because
of
of
the
yeah, because
allergy and the
airway
hypersensitivity
reaction of constriction
remains
all
the
becomes the
same.
worst thing.
They,
Yeah.
they remains more or less the same. So there is a lot of overlap
Overlap.
in these symptoms, and sometimes it really becomes difficult to distinguish, diagnose, and definitely to treat.
Since we are talking of smoking, so we'll like to cover alcohol over here also. That we understand that alcohol per se may not affect the respiratory system, but alcohol do increases intolerance at times. So, how alcohol affects when it comes to allergy?
So, before I answer your question, I'll take the liberty of extending this smoking to vaping and hookah,
Okay.
right? Vaping and hookah are not as bad as smoking, they are far worse,
Okay.
right? They're far worse than smoking, and there are two or three things which I must say, because there may be younger audience also, those who are watching this podcast. So the message must go to them. Uh, Vaping and hookah are far worse than smoking. I'm not encouraging you to smoke, but I am saying that do not do vaping and hookah. Uh, because we don't know what is the content of this vape, and we don't know what is the content of this hookah, right? And what are they putting into it?
Yeah.
In smoking we know what is the content,
Yeah.
and we know
Yeah.
that if you smoke 10 cigarettes a day for 10 years, you will eventually get a cancer
Yeah.
or
Yeah.
a COPD, or we know everything, but we don't know anything about vaping and hookah.
Hookah. This is the message which should go,
Yes.
that exposing your lungs to these irritants, these carcinogens, these pollutants has to be stopped. And at an early age, when your lungs are still developing,
Exactly.
you are taking those exposures, they are really bad.
They are really
And
bad.
very concentrated amount goes in vaping and hookah.
Yes. Now coming to your alcohol.
Yeah.
So alcohol, again, two or three factors. One, the physical temperature of the alcohol, the thandi beer and the
Yeah,
ice
it is
cubes.
cold per se. Huh?
So that whenever you're taking cold things, the mucosal membrane, it gets dehydrated, and again, as I said, that it is more receptive to, or more easily it can be penetrated.
Yeah.
This defense mechanism can be breached more easily when it is. So one is the physical nature of it. Then alcohol itself dehydrates your
Dehydration,
body,
yeah.
so that also creates a problem. Plus, if you are having alcohol, then your immunity goes down, that also causes a problem. So alcohol does add to the existing problem, so one has to be a little very
Yeah.
cautious about the use of alcohol also, and especially the binge alcohol is far worse than just a social drink.
Yeah, very important to understand all these interplay, and uh, these things, when over the period of time have been labeled as not good, there are far more reasons and far more science behind it. Well, after talking about how it affects and who are all predisposed, let's get down to what all ways it presents. So as you see patients day in and day out, what are the common symptoms you get in a patient who is suffering from allergy?
So there can be variety of symptoms, and every patient presents in a different way. So one is the nasobronchial allergy. This is one pathway. So you may have stuffy nose, running of nose, a little sore throat, and then when it travels down to your lungs, you may have cough, you may have frank symptoms of wheezing and bronchial asthma, that is breathlessness and wheezing. So you may have that as well. The second thing is the skin allergy. You may have itching, you may have rashes, you may have suffused eyes and tearing, and itching in the eyes. You may have bloating sensation, nausea, vomiting if you are if your
Food
GIT, if you have a food allergy, or if your gastrointestinal tract is displaying the symptoms of this. One very important thing, one which one must know, and in fact, you are a bhooked bogey of that while eating the prawns
Yeah.
at Goa, is anaphylaxis. So if you are really allergic to one particular thing, and if you have not been exposed for a large part of your life, as soon as you are exposed to this, especially in the large quantum, then you can have what is called as an anaphylaxis,
Yeah.
a severe breathing disorder. Then there is a drop in the BP, then there is a drop in oxygen saturation, and it can eventually be fatal also, right? So right from just a mild hay fever or mild itching or itchy eyes, these symptoms can go all the way to the death, and everything happens in few seconds.
Symptoms can be just localized to that particular organ, and it may be systemic.
There can be 2 or 3 symptoms that are involved this. So you can have bronchial asthma and itchy eyes, you can have bronchial asthma and bloating of the abdomen, you can have itchy eyes and itching or rashes on the skin. So you can have anything, it's a
Yeah, yeah,
bhel
yeah.
puri of the symptoms for each patient.
So, as allergy is such a wide topic and we are discussing it right now, it affects so many different organs. So, let's start and talk more about what is most common, that is the nasobronchial one, the one which is affecting the respiratory tract. And also, out there, differentiating it with an infection, its existence with co-infection, it becomes very difficult at times. Well, even as a medico, at times it becomes so difficult for me to answer someone ki whether I'm having an allergic cough or I'm suffering from flu, whatsoever it is. So, can you please just elaborate on that?
Yeah, you said it very right. I mean, it becomes very difficult for us to differentiate between a flu causing cough and allergy causing cough, right? And to make the matter even worse, both of them occur during the same season.
Yeah.
This is the same season where you have the allergic cough, and this is the same season where you have flu doing the rounds in the society. So and the third thing is that you have a flu which sort of upticks the
Allergic symptoms and all.
allergic symptoms and hypersensitivity reactions in your body. So all these combinations we see in our life, in our clinical practice every day. The most common symptoms are, as I said, that you have running of nose, sneezing, more so when you are changing the there is a difference in the temperature. uh, Over a period of time, when the patients are in the adulthood, they would know that okay, this is the time of the year, because there is a history.
Yeah,
They would
yeah.
know that this time of the year, or these are the things. The moment I enter into a room which has got agarbatti, I get into this
Yeah,
problem. The
yeah.
moment I wear a strong perfume, or I come close to somebody who is wearing a strong perfume, I get this kind of a problem. The moment I eat XYZ, or I eat peanuts, I get this kind of a problem. So you sort of memorize these things, and you try
And then
to
you
stay
corroborate,
away,
and with that
and then you
discussion.
corroborate. So when the patient comes to me, he has a history of this. Plus, what helps us in finding out whether it is more of allergy and less of flu kind of a thing is if there is a genetic predisposition. There are patients, those who would come and say that the moment there is a change in it starts raining, me and my father both starts coughing
Yeah.
each other, or we both start sneezing at the same time, right? So these are the things that gives us clue, and plus we'll discuss about the investigations part also, that helps us. But one more important thing which I would like to bring to your notice, and stretch this discussion right now, that the adults, they have got a history, they have been experiencing their symptoms for so long,
Yes,
and
yes.
therefore they are vocal about it. They can analyze these things. The problem comes when it is in the young
Children.
adults, in the cases of the children.
Yeah.
There are a lot of parents, those who come to me, and they would say, they won't say anything, but if I ask them, what happens when you go out to play? And then they would say, नहीं नहीं सर, ये ज़्यादा बाहर नहीं जाता, ये शर्मीला है, इसको तो अपनी किताब अच्छी लगती है, and he just
And it
wants
is-
to sit on the bed or on the couch and read. He doesn't want to go out and play with other
and it is
kids.
the inability to run because of
Exactly. It is because the kid is not able to tell it to the patient, tell it to their parents. He's not able to analyze that he does not want to play because he gets breathless while he's playing,
yeah.
right? So it is very important for, as a parent, to allow their kids to go out and play, do as much masti as they and as much hurdang as they want to, because this is what their age is.
Yeah.
They shouldn't be sitting at home and playing on the computer, mobile and
All the gadgets.
all the gadgets. They should go out and play, because that will help their lung and mental and physical well-being and development. The other thing that comes to my attention is that the kids, those who are in the school, they get very sick at the school sometimes, and when you ask them leading questions, they will tell that, okay, fine. Whenever the teacher writes on the blackboard or wipes it off, that's when he starts.
Oh, the chalk particle is the
Chalk dust. The chalk dust. In fact, there are teachers, those who visit me, and they say, some days it is bad, some days it is good. So I specifically ask that on the days when it is bad, is it that you're writing too much on the blackboard or you're wiping off? Right? And then probably it strikes to them as well as to the kid that yes, there is a lot of dust when they are wiping, and I immediately starts coughing. So not always the patients can make the association.
Yeah,
We
yeah.
do the leading questions, and then they realize that there is a association. By the way, in the chalk case, I have advised that they should use wet chalks. Now most of these schools, good schools, they have whiteboard and markers, so that problem is taken care of. But even those who have a blackboard, or you are supposed to write on the blackboard, just make the chalk wet, write and wipe it with a wet cloth. That takes care of most of the things. A small intervention, but a very effective one.
Now, what all your talks are again igniting the mind. It's all about being aware, proactive about your health. which takes,
Exactly. So as a parent, I think one must take care of the child, that what is happening to my child, why is he not going, is it let's say somebody bullying him,
Yeah,
or
yeah.
is he weak, or is he
And
does he
at
get
times we
breathless?
just make our own
Assumptions.
assumptions.
हाँ, नहीं ये बहुत पढ़ा हुआ, इसको तो किताबें दे दो आप, तो वो खुश रहेगा. So that kind of
you're
things
right.
that so these are primarily the symptoms that and not only in the kids, even in the adults, if I ask that, how many floors can you climb, डॉक्टर साहब वो तो मैं एक्सरसाइज करता ही नहीं हूँ ना, वो तो मेरा वजन थोड़ा सा है ना, इसलिए आई गेट ब्रेथलेस. And you start treating them with the same weight, with the same body form, with the same exercise, this thing, they can climb 2 floors
Yeah,
or 3
and at
floors.
times people may think about the cardiac cause, but they will not think about the
Asthma,
allergy causes. asthma
allergy
causes.
and asthma cause.
Yeah,
Yes,
yeah,
that is also one very important thing. Cardiac is although important, but I always wonder that why this young individual who is got no other problem and lean and thin and fit body, why is he visiting a cardiologist and not going to the pulmonologist?
Yeah.
But thankfully, the cardiologists are also aware of this entity, and they redirect these patients to the pulmonologist most of the time.
Taking the discussion forward, it will be great, as we discussed about a lean person not able to climb up. And so when do we call it is asthma? When this allergy becomes asthma? If you can just enlighten us.
So this allergic bronchitis, asthmatic bronchitis, asthma, these are the various terms which can be which are used very loosely.
Yeah.
So there is one clear distinction. Allergy is your body's response, right? Asthma is a display of the symptom. You know, the constitutional symptoms. The if you have, there are specific diagnostic tests like a pulmonary function test apart from the allergic tests that we do, which tells. So if there is a bronchoconstriction means the airways they constrict. If this is the thing, then the patient displays certain cough, certain breathlessness or breathlessness on exertion, nighttime symptoms. All these things, this falls in the category of asthma. Sometimes what happens is that you are not suffering from asthma, but you have a flu, then you get into this bronchial hyperreactivity. So the treatment is similar like asthma, it's just that it does not have a future. It comes, it dies down, and then you are fine with this. But when it is predisposed, when it is allergic, then it is difficult for me to tell you whether you are cured of asthma or not. But one thing for sure, with the inhalers and with the medications that we have today, you can lead a symptom-free life, and you can do whatever you want to.
With your immense experience, what I can make out very clearly is that right medication, right time, you can be symptomless or symptom free in allergy.
Yes, and a very good compliance with the medication and consistent with the medication. That is very important. I mean, if you lose out on this, if you try your own concoction, if you're not listening to your physician, then you will not get the adequate response.
Just to elaborate further, can you just add some point on self care of asthma over here?
So self-care is different from self-medication.
Yeah.
Self-medication is without any aim, without any goal. You just go buy certain things from the chemist and you take it. But self-care means you should be aware of what your symptoms are. You should be aware, okay, this is the time that I should take this, and this is how you should start treating your own asthma, obviously with the help and guidance of a physician.
Yeah.
And report to the physician if whatever he has said is not following that path.
Yeah.
Right? So we have got various things, various instruments, various tools to find out how good or bad your asthma is. One of them is called as a peak flow meter. It's slightly long tubular structure with marking on this, and you're supposed to inhale deeply, put it on your mouth and breathe as hard as possible. So it tells you a value. This is your peak expiratory flow rate, right? And you would do this, you will first find out what is your personal best by doing it multiple times in a day for 10 to 15 days. And the value that comes again and again and again is your personal best. Once you have found your personal best, then you would do it as and when required, when you feel little low, when you have some symptoms, or even otherwise when you're not having any problem, or if you feel that, okay, this March is now coming, Holi is approaching, and this is not the right time. So you start doing it. It's like a thermometer, right? That your peak flow. And I always advise my patients to write it down on a
So the intervention changes if the peak flow rate is changing.
So if it drops by 10%,
Okay.
that means you have to increase your inhalers,
Okay.
right? That means you have to increase your inhalers. And if it fails to improve, if your peak flow fails to go up again, despite of increase the inhaler, you must see a doctor as soon as possible. I can tell you that the day when you feel that you are having this problem, your peak flow, if you're doing it right, your peak flow can detect it 5 days earlier.
Oh.
Right? So if you,
Even I was not knowing that.
yeah, so if you start doing intervention 5 days ago, you will not have this symptom. And the lesser the symptoms are, the better it is.
So, as you were talking about that, the medication can be controlled by a self care, by a guided way. Going ahead with it, there is a lot of myths like these inhalers and spacers have steroids in it. Steroids are overall bad for health, so people leave that and then precipitate their asthma.
Oh my God.
So,
Half of my consultation goes in telling the people and breaking the myths of this inhaler.
yeah.
Good that we are discussing this. Next time when they come, I'll give this clip to my patients that please watch this and save my time every time. There is a deep myth. One, the inhalers can be addicting. Those who are diabetic on insulin, they take insulin. They are not addicted to insulin. It's the treatment. It's your body's requirement. So if your body is requiring inhaler, you must take inhaler. The day you're asymptomatic without the inhalers, you can stop inhalers, obviously with the guidance of your physician. The second thing is about the steroid content. Imagine this steroid content is in micrograms, right? And this inhaler, when you're taking this inhaler, it is getting delivered directly into your lungs where it is supposed to act. If you get sick, if you are into exacerbation of asthma, we admit you in the hospital. I give you intravenous steroids in milligrams, right? In milligrams, 10,000 times more dose than what you are taking via inhaler. And this intravenous steroid is traveling all throughout your body,
Systemic.
affecting all the organs of your body, and a part of it is going into the lungs, right? But here what is happening is when you're taking inhalers, the entire stuff is going into the lung. It does not get, or very minuscule amount of it gets absorbed into the bloodstream, but it gets deposited there, it works there, and then goes away, right? So this steroid, and obviously, let me also tell my patients here is when you're taking this inhaler, especially this steroid one, make sure that you rinse your mouth, right? So any deposition that is in your oral cavity is taken care of. So nothing gets absorbed into your bloodstream. It just goes directly there, gets deposited there, acts there. So these steroids are not harmful. In young individual, there are certain reports which say that, prolonged and high doses of inhaled corticosteroids may cause in some individuals some growth retardation. That's okay. But imagine if you're not using this, then what are you doing to that kid? Throughout the life, he will be just sitting in an isolated room. He will not have the ability to interact with the strangers, ability to, do a sport.
It's like risk-benefit ratio has to be done by the expert, not by the...
I would rather use that inhaler in that child and let him play, go out, talk to the friends, and then, fight with friends and make friendship and do what a normal child does, right? So steroids are not harmful. They are in fact beneficial. But let me also add one thing. Why are we giving steroids? We know as a doctor, we know that these steroids are harmful. Why are we prescribing, and why I am advocating for these steroids? So there are two types of inhalers. One is a reliever and one is a preventer. Right? The reliever, what it does is that there is a constriction in the airways. When there is a constriction in the airways, why is there a constriction? Because of the hypersensitivity, because of the allergy, right? There is a bronchoconstriction. Now, when I give this reliever, it acts and it releases this directly, right? But the cause why it constricted at the first place has not been taken care of. So we give steroid. It coats the inner surface, right, and prevents the further allergen to go inside, right? So it prevents from what is called as a remodeling. If you are only using preventer, then you may be fine now, but 5 years down the line, the things can get worse, and then you will be persistently breathless if you're not using steroid. So it is important that you use steroids. So one, inhalers are non-addictive and steroids are safe. If you can just, make this two statement viral, that will be of great help to me definitely, but my patients and the community at large.
So in the middle of talk, I'll just like to give a take-home message that you should stick to your doctor advice. Every steroid dosage is not harmful. It's the right dosage which is given by the doctors, and sticking to it is far more important than planning your own treatment by few half knowledge that steroids may destroy your health or they might be addictive. So you explained very beautifully how the treatment should be taken care of when it comes to asthma. What are the diagnostic things which you do in asthma?
Yeah. So one thing, the asthma is more of a clinical diagnosis rather than a test-based diagnosis, and we do certain tests to one to um, define asthma or to diagnose the asthma, and number two, to exclude any other thing that may behave like asthma. So these are the two aims of doing a particular test. Like we do the X-ray, not that we are expecting the X-ray to be abnormal, but we are doing the X-ray just to make sure that it is only
No other
asthma and
infective
nothing
pathologies,
else,
yeah.
no other infective pathology, or there is no other problem with the in the lungs which we might miss on the clinical history taking, as well as by auscultating the patients. So it is more of a clinical diagnosis. What I discuss with the patient helps me diagnose this. When I examine the patients, there are classical wheeze and the rhonchi, these whistling sounds that are sometimes present that I can pick up on the patient.
Just for the viewers, wheeze and ronk are the sounds which are heard when a doctor auscultates the lungs, and they are different, and they can. It's something which they can differentiate by their practice.
Yes. And we hear this with the stethoscope.
Yeah,
But
yeah.
sometimes the patients do come and they tell us that they have this wheezing and the whistling sound.
I've
So the patients can also hear them. But more often, when it is not so symptomatic, we take use of the steroid. But so this is one aspect, that we want to exclude certain things. But to find out whether this how much of allergic component is there, we do certain tests, like we do IgE,
specific
the
IgE.
specific IgE, which is, and the absolute eosinophil count. So in some patients the Ig levels are high, in some patients the eosinophil counts are high, and they are both the component of the, or in the scheme of the allergy that they are raised. Some patients have high Ig, some patients have high eosinophil, some patients have nothing which is high, or some patients have both which is high. So these are the things. Then to test the capacity of the lung and to see if there is a response to the inhaler, we do what is called as a pulmonary function test with bronchodilator reversibility. So we do the pulmonary function test, wherein the patient is asked to do certain maneuvers like blowing in, blowing out, and holding the breath. All these maneuvers are there, and patient do these things as instructed. And then we repeat them after giving them the inhaler, so that we know that okay, there is a 20% improvement that stamps the diagnosis of the asthma. Not always we see this. There are certain patients, those who may have a normal spirometry, still they may have asthma, and therefore I said that it is more of a clinical diagnosis.
Agreed.
There is another test which is called as a pheno test, which also demonstrate that how much of inflammation or is there in the lungs. To find out what kind of allergy is this, we have allergy panels, the comprehensive allergy panels, the Fadia top, which gives us the IgE values of the specific most common allergens in the society. So these are the things that we ask these patients, and when they come back with the results, that helps us define and diagnose the asthma, and also plan a long-term treatment for the patients.
Yeah. So just to add on, as we understand that we do some blood tests out there in which we test for us immunoglobulin, which is a protective protein, IgE specifically, against the predisposing factor. And what, as a pathologist, which I like to put a case that we do a lot of component testings and Fadia top testing for those specific allergens, and there are mixes on the basis of symptoms which a clinician order that we like to look for respiratory allergy or for a food allergy. But at times we get both the spectrums. We get a spectrum where we have tests which are positive, but patient is having no symptoms. Then there are times when patient is having symptoms, but we are not getting any of the IgE positive. So, can you just talk about the cyclability and the presence of IgE in the blood, and why it's not always corroborative or perfectly diagnostic, rather it is a complementary thing?
See, in allergy, one must understand it is the basic inherent quality of this disease is that it is episodic in nature.
Yeah, yeah,
Right? If you are exposed to that allergen, you display symptoms. If you're not, then you don't.
yeah.
Right? And plus, if you're on certain drugs, for example, if you're on steroids, if you're on anti-allergics, your display of the symptoms is muted, is subdued, right? So is the IG response and many other things, tests that we are doing. My simple take home message is that as a physician, I would like to treat the patient and not the reports,
Agreed.
right? I will base my treatment on the patient's symptoms rather than the reports,
So it
right?
is perfectly possible that a patient may have symptoms but may not have anything positive in the report, and vice versa. It is just whether that at that time when the blood was taken, that IgA has spiked or not. That person is in that reaction for that particular thing. Like we get people who are, say, their report will say that they are allergic to, say, egg, cockroach, but in a real
But they
life they
have
are
been,
not,
they have
because
been,
their body has subdued the reaction. It is not
yes.
showing any clinical symptoms.
Yes, yes,
So
yes. So both these things are possible.
yeah,
And as I said that I would like to treat the patient and not the report,
fair.
right? The reports, they help me in making a plan for the patient,
Yeah, yeah, yeah,
right? Every time, but not necessarily I'll go by
yeah.
what the reports
Well, it's
say.
great if we get some lead out there. It's very,
Exactly,
very
exactly,
complementary and, to the treatment. But even
exactly.
if it doesn't, we'll have to treat presumptively.
In large subset of the patients, what I feel that when I'm prescribing the test, then I feel that okay, these are the tests that I suspect that these would be positive, and when they come positive, that gives me more confidence,
Yeah.
right? So in that way, it really helps. But
Yeah.
in small subset of the patients, I agree. You can have mismatched report. In
Yeah.
that case, I would give preference to my patient's
Yeah.
symptoms.
So yes, right tests are very important to understand which allergy is there and to prevent it. But it is not just the test; it is the clinical history, the presentation, etc., which define the whole course. Just going deeper in the test, as we understand, it's not just the blood test. There are in vivo tests also. For the audience, in vivo tests are the tests which are done inside the body, and in vitro are which we do outside. So all the blood tests are in vitro. So we'll like to talk about in vivo test, that is the intracutaneous and intradermal test.
Yeah, so these are
Skin.
the skin prick test,
Yeah.
wherein the commoner allergens, we have got a very diluted form of these commoner allergens, and we prick these in on the skin
And you study
of
the
the
wheel size.
on the forearm or on the back.
Okay.
We put 50, 60 different allergens, very minute quantity of a diluted allergen, and this helps us find out because there is a local reaction over there of the same mechanism which otherwise would have been on the entire body,
Either it would
right?
have been lungs or in the
Or
GI
in the
tract.
GIT
We are just
or the urticaria.
yeah.
So we have got the entire panel pricked over there, and then on the 4 or 5 places, we'll see a adequate response by the body, the or hyper response of
Yeah.
the body, and therefore we'll see a reddish wheal which is slightly raised and it's red in color, and then we'll come to know that okay, this is the
Got it.
these are the antigens, these are the allergens that can or are maybe possibly related to your symptoms. So that's how also we diagnose, but it is quite a tedious process. Sometimes there can be little complications also. The patients may over exaggerate the symptoms, but then it's otherwise it is quite safe, but a quite tedious thing to
Got
do.
it. Got it.
The only thing is that as we discussed about the tests, that something can come as positive or negative. We must know that these tests, they have got a limitation. At the most you will be able to do 20, 30,
Yeah,
40
yeah, yeah.
items, right? But in life you are exposed to many
Thousands
more.
of them. And just for the audience elaborating it, that what we see just in as egg itself may have multiple components which may
Exactly.
cause allergy, and we
Exactly.
don't know not just the egg white and egg yellow. Egg white may have another 10 components, egg yellow may have another components.
Yeah,
So
yeah.
somebody may have an allergy to a half boiled egg taking yellow, but may not have an allergy to a full boiled egg.
Exactly,
So
exactly.
just
Nowadays, these component tests are also
yeah, they are very much
coming up.
available, and
Yeah, yeah. So one can go for that also. But I have reserved these tests for a specific subset of the patients in which, despite of going to the maximum treatment, we are not getting adequate response. So we would
yes.
like to find out one object or one item, if we can take it away from their life, that will have a significant response. So these are the tests. They come really handy for those subset of the patients.
It was really great to know so much about allergy, and still, I feel it's such a big topic that we can have multiple discussions out around the same. But really thankful for your today's enlightening talk. Great to have you, Dr.
No,
Ashish.
it was my pleasure to come here, and we had such a lively discussion. And I think that we have been able to share some important message to the general public, and that will
Yeah,
help
yeah,
to
yeah.
take care of themselves.
It's all the way you have put it at every point you have very clearly said. It's all about knowing yourself better and believing in the treatment and sticking it to the same.
Exactly.
Yeah.
Compliance and consistency is two very important thing. One must go back to their doctor if they are not getting the adequate response to the therapy, and that's when the doctor can titrate the therapy.
Thanks. Thanks a lot, Dr. Ashish.
Namaste.
Thanks, viewers and listeners. So much to know about allergies, so much to know about how to take care of your health in allergy. So stay healthy, stay wise. Till we at Tata Energy bring care to your health.